and gentlemen, and welcome to the next in the series of NCAER's Coronavirus briefings. This is part of a series that we started in early April and have continued through April, May, June, and now into July. And it seeks to both present original analytical work that NCR is doing on the coronavirus pandemic, but also affords a platform for others to come and share their work and their ideas and their views on both the issues of what's happening to the health infrastructure and health outcomes that we are all concerned with, but at the same time, what's happening to the economy and to livelihoods and to poor people in India. I'm delighted to have Professor Sonalde Desai and Dr. Santanu Pramanik, both at NCAER. Dr. Desai also is a professor of sociology and demography at the University of Maryland at its campus in College Park. They're both at NCR's National Data Innovation Center, which has been doing a rapid response survey of the Delhi National Capital Region, and we are delighted to be releasing at this webinar the findings from the third round of the Delhi NCAER Coronavirus Telephone Survey. I'm going to request Santanu Pramanik to go first and tell us about the key findings, and then Professor Desai will join in with some special focus on what's happening to different categories of workers. So with that, I'm delighted to welcome Sonalde Desai and Santanu Pramanik. Santanu? Sorry, before you start, I should have mentioned, though we're also zoomed in or zoomed out, that I'm sure all our participants are aware. Please feel free to forward your questions on the Q&A box on your screen, and I'll request both Sonal and Santanu to take up questions as they like while the other is speaking. So we'll try and get to as many as we can of your questions. So with that, again, back to you, Santanu.
Hi, thank you, Dr. Shah. So let me share my screen. You can see my screen, right?
Yes, it's quite visible.
Okay.
Sorry, Shantanu, just go to view and press full screen so we don't need to see all the icons at the top.
Yeah, sure.
Thank you.
Okay, thank you. Okay, good evening, everyone, and welcome to NCAER webinar. I'd like to thank you all for joining on a Saturday evening. So today we'll be discussing about the preliminary findings from Delhi NCR Coronavirus Telephone Survey Round 3. Some of you are aware of our earlier rounds of surveys and the findings from those rounds. It's a beautiful background here. Who would have thought to see a photo of Connaught Place like this empty? So it's just unthinkable, I think, in the last March. Even now, I think it's not like that. I think the photo was taken sometime during the lockdown. So before I begin, I'd like to acknowledge and thank contribution from different individuals. I mean, without their contribution and support, this work would not have been possible. So first and foremost, the National Data Innovation Center team, NDIC team, I mean, I don't want to take individuals' name, then I'm sure I'll forget some. So, I mean, our field manager, field coordinator, programmer, database manager, and all other team members who contributed in questionnaire designing, data quality monitoring, etc. And along with that, the researchers from NCAER outside the NDIC team, they have also contributed significantly, particularly our NCAER senior management and many other senior researchers. And also we have an external advisory group. I'd also like to acknowledge their contribution. So all these things have improved our questionnaire, our thinking substantially. So I'm really thankful for that. Okay, so as we are emerging from the lockdown, so it is important to understand the reactions, challenges, and potential solutions from the perspective of different components. I mean, there are multiple components, multiple dimensions to this complex problem of this pandemic-induced lockdown and emerging from the lockdown. But we, in our presentation, we will focus on 5 key components. First is the individual, how people are changing their behaviors in order to remain safe during this time. The second key component is the labor market. So the findings suggest that the farmers and the government workers, they are relatively protected compared to the casual wage workers and the small business owners. The households, they have suffered a severe level of income losses during this time and experienced price increase. They had to, many households had to borrow to meet day-to-day expenses. Some of them also experienced occasional unavailability of food, and some also, and since rent constitute a core component of our expenditure, regular expenditure, many of them were not able to pay rent during this time, although the proportion of households who stay in rented accommodation is relatively small, but the impact for them was quite severe. Next, we will be talking about the policy responses, particularly from the perspective of the government welfare measures, the reach, the targeting, and the adequacy of different government welfare measures that have been announced during this pandemic time. And then the next stage, because this situation is going to continue for a while, and how we can adjust to this new normal and what are the specific needs of this new normal. So these are the 5 key components that we'll be discussing today. So this is the timeline throughout our journey of DCBTS. So the first round started in early April, and the second round happened towards the end of April. So both the rounds were designed or planned and designed in such a way that we can complete the survey and produce some results for the policymakers before the before the announced end date of lockdown. So for DCBTS 1, it was 14th April when the first lockdown was getting over, and for DCBTS 2, it was, I think, May 3rd when the second lockdown was getting over. So after that, we thought of understanding the situation when the reopening of economy in the phased manner starts, and accordingly we thought of conducting another round of DCBTS. That's the third round of DCBTS. So it was planned after the phased reopening announced at the end of May by the Ministry of Home Affairs, so which is now called Unlock 1. So just to give a relative comparison between the first 2 rounds and the third round. So in the first 2 rounds of DCBTS, we have, because those were the early days of the pandemic, so we try to understand the people's knowledge of coronavirus symptoms and preventive measures and their attitude towards the danger of coronavirus infection and the risk perception, and also their attitude towards lockdown, whether they like it, whether they want to extend it, etc., and also their practices of preventive measures with special focus on social distancing and the impact on livelihood and income, and also access to essential items and price rise as well. And in the second round, we also captured how the government welfare measures, whether that is helping them in overcoming some of the challenges. So in round three, DCBTS 3, since the reopening of different activities and reopening of the economy has started, the key challenge is to protect the public health alongside getting the economy going. So in that context, how one can remain safe at the same time starting their work or business, that is a key challenge. So that's one we wanted to explore, we wanted to understand through DCBTS 3. Also, we continued collecting data on social distancing and people's risk perceptions, as well as impact on livelihood and income. So a special focus of DCBTS 3, which Sonal would talk about in greater detail, how it has impacted different occupational groups and what are the different challenges they are facing. And actually we found that they are very different in nature. So that would be the next part of this presentation. And also what are the challenges people are facing in getting back to work or business. And then we have collected data on the reach, adequacy, and targeting of safety nets. So in this round, we collected data on both the government and non-government relief effort. So briefly on the methodology, so Delhi NCR is our target population. So I mean, it may not be apparent from the name, but it not only includes the metropolitan area of Delhi, it also includes districts from nearby, so districts from Haryana, Rajasthan, and UP. Some of them are really far flung, say Alwar, Bharatpur, etc. And we have approximately equal proportion of urban and rural households in our sample. So in DCBTS 3, we have a larger sample. What we did, we followed up the sample, followed up the households from DCBTS 1 and DCBTS 2 both. A larger sample size was considered in this round to allow for disaggregated analysis at various levels. And the survey was implemented by 35 interviewers over a period of 9 days. And since we are still in the lockdown and restricted movement situation, the interviewers were trained through Zoom. And different communication mechanisms were used to ensure that all the confusions and doubts are clarified for the interviewers. And the median interview length for the completed interviews was about 14 minutes. Okay, so now the response rates in DCBTS 3. I'd like to spend a couple of minutes on this slide because there are a lot of discussion in the recent times about the quality of phone survey, the exclusion usually happens in phone surveys, and how does that impact the estimate. So we have achieved an overall response rate of 66% in DCBTS 3. So out of total 5,248 households, we are able to complete 3,466, which resulted in this 66% response rate. But out of these non-responses, it was mostly due to non-contact. So our non-contact, which can happen for many reasons, such as the wrong number out of service, phone switch off, out of coverage area, incoming facility not available, etc. So our non-contact rate was 26.3%. So among those whom we contacted, the response rate was quite high, which is 90%. So it's almost similar to what one can expect, one usually see in India in face-to-face surveys, so 90%. So in that regard, it's not very different from the perspective of response rate. Basically, we encourage the interviewers. We put a lot of effort to ensure that whom we were able to contact. We make sure that we complete their interview so that it's not only those are included in the sample who are willing to participate in surveys, because we know that the non-respondents are often of very different characteristics compared to respondents. So if we just exclude the if we exclude the individuals or households who are unwilling to participate, then it would lead to some bias in the survey estimate. So we are very mindful about that. So it's just because having a large sample size doesn't ensure absence of bias, because sample size only contribute to control the variability of estimate. So that's how we try to minimize the bias as much as we can. So I'd be happy to answer more if you have questions on this. So now some basic characteristics of our sample. So as you can see that they are proportionally distributed across 4 states as per their distribution in the Delhi NCR region. So we have sample from both orange and red zone. And as I said, the urban and rural proportions are almost similar. In terms of, the primary source of income, so this is again the key component of today's presentation. We'll see how different occupational groups, the farmers, casual wage worker, businesses, and the salaried workers are impacted. In terms of respondent characteristics, the main difference, the key highlight I would say is the disproportionate distribution of the gender, which I think is a key difference between the phone surveys and the face-to-face surveys. In face-to-face surveys, in household surveys, we have seen that the respondent, the gender distribution is almost equal. So it's in proportion to what we see in the population. But in phone survey, it could be because of access to the phone. It could be because of the gatekeeper of the household doesn't let the female to talk, or whatever reason. So this is a very skewed distribution we have seen in terms of gender distribution. But in terms of other age category, education, etc., it's very evenly distributed. Okay, so now coming back to the findings. So as the lockdowns are eased, in order to remain safe, communication strategies around the world have stressed upon the following key messages. So here we would like to see in the next slide, where do we stand, where do the residents of Delhi NCR stand in terms of adhering to the above guidelines. So first of all, who goes out? So we have a question in the questionnaire. In the last 1 week, did you go outside your house for any reason? So this was relevant to the for the respondent, and what we found is that 73% of Delhi NCR residents, they went out at least once in the last 1 week, and there's no significant difference among respondents from different states or rural urban areas or red or orange districts. Female respondents are less likely to go out. That's probably true in normal circumstances as well. Another important finding, the respondents aged 60 years or above are significantly less likely to go out, but still a large percentage, 61%, went out in the last 1 week. So we are not fully successful in sending the elderly who are at the maximum risk. More educated respondents and salaried workers are more likely to go out, which makes sense. And also we see that these are the groups who are actually taking more precautions, so which is a good thing. So now we know that what percentage people are going out, but when they go out, so we have a question in the questionnaire. The last time when you went outside your house, what precautions did you take? to prevent yourself from getting infected with the coronavirus during your visit and after returning home. So here we found that wearing mask is near universal, uh, and uh, and there is no rural-urban differences in taking different precautions. Women are less likely to take all three precautions compared to men. So here by all three key precautions, I mean wearing mask, washed hands with soap after returning from outside, and maintaining a distance of 3 feet or more when you are outside. So these three key precautions. So we found that 32% respondents, they are taking all these three key precautions, which is not as high as one would like to see. So that is a very important finding. If we are in this situation where we are sort of reopening the economy at the same time, we want to remain safe. So now, what activities people started to do as the lockdowns are eased? So we found that 78% in 78% households, people started going to workplaces, which is remarkably high. And 18% households, people either visited family, friends, relatives, or attended social functions. In 12% households, people started to visit the public places of worship. And naturally, in rural areas, the prevalence of starting regular activities are higher compared to urban areas. The only activity that has not started at all is the educational and learning activities, since the school, colleges, and all the educational institutions, coaching centers continue to be closed. So now when we compare this data with the data that we collected during DCBTS2, when they were asked what they would like to resume if lockdown is lifted, we see that compared to their responses in DCBTS2, they are actually started doing more proportion of people have started doing those activities than what was reported earlier. So which is a good sign for getting the economy going. So as I said, only one activity because people expected it to begin, but that has not happened as the educational institutions remain closed. So now the trends in social distancing as the lockdowns are eased. Since we have seen that 78% people have started going to work, etc., we expected that the number of contacts people have when they go out would increase. But we didn't see that happening that much. The number of zero contacts remain almost the similar as it was during round 2. Although the number of higher contacts like 5 to 9 or more than 10 has increased significantly compared to round 2. But this data, I'm a little bit skeptical about the data. This could be subject to social desirability bias because I expected to see the number of contacts to increase much more compared to earlier rounds, but that didn't happen. The risk perception is remain the same as it was before. People continue to think that they don't have any chance of getting infected, which we found very unusual, very sort of unlikely from the very beginning. But in 3 consecutive rounds, we have seen the same trend. So now the reduction in household income, the results are very similar what we have seen in earlier rounds of DCBTS as well as in many other surveys being conducted in other states across India. So 85% of Delhi NCR households reported some level of reduction in income compared to the time before lockdown. This is some level of reduction, but and there is no urban-rural differences. But when we look at the percentages of reduction in income of a large extent, which is very much according to our responses. So there we found that there is significant urban-rural differences. Urban households have experienced much more reduction in their income. And we'll discuss in more detail about the impact on the occupational groups, but just an overview slide. Here we have, here this figure suggests that the larger level of income reduction happened for casual wage workers. That means the household having primary source of income as casual wage work, which is the leftmost bar, the casual wage worker and the businesses, the level of income reduction for them is much higher compared to the farmers and the salaried workers, as well as the other category. Other category include the households having primary source of income as rent, pension, and remittances. So now the challenges faced in returning to work or business. So here we have found that key challenges faced are worry about getting infected. So this is again a contradiction we have seen, that people are worried about getting infected. At the same time, they don't perceive of that they can get infected. So these are very contradictory finding we have seen throughout actually the rounds of surveys. So the key challenges is getting the worry about getting infected, and also difficulty in finding work. And also in urban areas particularly, we have seen people reporting low demand of goods and services as a key challenge. And about 37% in rural areas and 25% in urban areas mentioned that they didn't face any challenge in returning to work or business. So I'll stop here and over to you.
Sonal, you're going to continue. You're muted, Sonal.
It is fairly clear that phased lockdowns are here to stay for the next few months. Disease will recede in some districts, surge in others. So it is important to know how the lockdowns have affected the lives of people and the challenges of recovery, so that we can be prepared for rolling lockdowns in future periods. In a way, we find that this is a sort of a brave new world, which none of us really understand or know much about. So for us to undertake a survey was very difficult. And one of the first things we did was several of my colleagues carried out detailed qualitative interviews with people in different work categories or occupational groups, so that we can design the questionnaire. We also have a phenomenal advisory panel that advised us on how to, where to focus, how to sharpen the focus, sharpen the questions, and so on. So while I am going to go ahead and present quantitative data, some of our insights have come from the qualitative data. I am now going to start sharing the screen, Santanu. So okay. Let me just reiterate the different categories of workers that we are going to be looking at. We have about 18% households whose primary source of income is farming. 35% are salaried employees or employees who get paid at a monthly level. Now remember, this is Delhi NCR region, so we have government workers as well as private sector workers as well as the domestic employees. We have about 20% who are small business owners, and about 23% of our sample is daily wage laborers. So I'm going to go through each of these categories and tell you what their experiences look like. The first thing I want to start with is what happened to the employment in each of these categories through the lockdown and in June as unlockdown has begun. For the farmers, we basically asked them about their work in a pre-lockdown period, and then sort of whether they were able to engage in farming between April and June. So here we combine both the lockdown and unlockdown, and we find that about 97% of the farmers have continued their work, and hence they are relatively less affected due to the lockdown. For salaried workers, there was a sharp drop during April and May, with only 44% continuing to work in April and May, and people who got paid while staying at home and couldn't work are still considered to be employed for this particular purpose. And there has been a return in June to about 65%, or at least first half of June. So there is some coming back. For the small businesses, there was a pretty sharp drop in April and May about people who were able to carry out their business, and I'll go into a little more detail on that. About 76% are now back doing work, operating their business, at least at some level. Casual laborers, there was a pretty big drop of, and only about 32% were able to find any work in April and May, and most of them were agricultural laborers, with about 62% now able to find work in June, but they suffer from a variety of other challenges, which I'll talk about in a few minutes. We also looked at various signs of distress, specifically, as Santanu mentioned, about 54% experience major income losses. 14% experience some hunger. And let me specify the question that we asked, okay? Since the lockdown, has there been any time when you or others in your household did not have enough food to eat because of lack of money or other resources? And 14% said yes. About 64% of the renters could not pay full rent. 44% had to borrow money for expenses to manage day-to-day consumption. And about 38% experience increase in food prices. Here we are just focusing on our grains and pulses. If we include vegetables, it's about 44%. So what I will do is I'll go through each occupational group and tell you what has been happening to them, and focus on 3 markers of economic distress: major income losses, hunger experience, and borrowing, to sort of validate some of the results on their experiences that we might see. With farmers, I think they have basically been trading water. There has been some advantage in rural areas because farming was pretty much allowed throughout the May, and lockdown was relaxed, but they do experience some challenges around transportation, getting the goods to the market, etc. We found that after a very early pause, about 97% of the farmers were able to continue cultivation. However, they did change their pattern of hiring laborers. Okay? Among the people who used to hire laborers, okay, about 25% did not hire at all, 22% hired less than they needed, and 52% continued to hire. And a lot of it was, some of it was because labor shortages, some of it was because fear of coronavirus. Some of them said that we manage with family labor because family members who used to work in other positions couldn't work anymore and contributed to the farming, etc. April and May were particularly challenging for transportation of goods to market, and prices were lower. What we found is that a large number of respondents had difficulty in transporting their goods to the market or to mandi, and some of them were actually not able to get it in at all. About 21% of the respondents said that they got lower price than the usual for their produce, and 70% were unable to sell at all. So for farmers, while the farming was permitted and they could continue, transportation and getting the goods to the market was a major challenge. Looking towards Kharif, we also asked people whether they are facing any difficulties in obtaining inputs in preparation for Kharif crops, such as seeds, fertilizer, equipment, or labor. And about 15% identified some sort of a difficulty. Again, a lot of difficulties were associated with obtaining seeds, fertilizers, and pesticides. And with some, there was a difficulty getting laborers because the labor might, due to transportation restrictions, some of the workers might not have been able to come. This relative immunity of farmers to lockdown is also reflected in welfare indicators. So, what I'm going to do is I'm going to go through all the different economic categories, and in each one, I will show you orange bars, which reflect the average for the public sample on income loss, borrowing, and going hungry. And the green bars will show where the particular occupational group that we are talking about stands compared to the average. And you'll see that farmers are less likely to have suffered from major income loss, less likely to have needed to borrow money, and less likely to go hungry. It is important to note, however, that the farm sample in DCBTS is drawn from somewhat better off districts like Western UP, Haryana, Bharatpur, etc. For salaried workers, I think basically the story is around heterogeneity, in which public sector employees were pretty well protected, whereas the private sector workers remained quite vulnerable. In our respondents, we have roughly about 65% of the sample which is in private firm or company. 20% worked for either government or public sector, and 13% worked for private or employers running a small business of their own. 2% were hired by households as domestic workers. So in spite of the fact that we are in Delhi NCR, a large proportion of our respondents do work for private employers. Many employers experience economic distress. Some of them took advantage of situation to relieve the workers or to reduce salaries. We found that only a minority of the salaried workers continued to work or received full salary. About 51% of the respondents did not work. 5% lost their job. 19% were able to work at the physical office or work site. 10% worked from home or for at least part of the time, and 15% worked from home totally. In terms of receipt of salary, okay, full salary was only received by 26% of the workers. 35% received partial salary, either reduced salary or salary for 1 month, but not for the other. And a substantial proportion did not receive any salary at all. 35% did not get any salary. About 4% said that, no, we haven't received any salary, but we do expect to get it when we can go back to work. Sorry. Salaried workers were somewhat protected during the lockdown, but that was particularly the public sector workers who were most protected. So, whereas the 54% of the general sample experienced large income loss, only 21% of the government workers experienced large income loss. 44% of the general sample had to borrow money, whereas 19% of the government workers had to borrow money. And the proportion that experienced some hunger or reduced food consumption was much lower. Now, I do want to caution you here. Our sample sizes are pretty small by the time we start disaggregating and slicing and dicing. So this should be seen as sort of a qualitative information, but would require to be validated through much bigger samples as sort of one goes along. Small businesses were particularly affected because both they were not allowed to operate and because the demand for their work really went down. So the question of when this will resurface and when this sector will start doing well remains a major challenge for the policymakers to think about as we go along. Of the businesses that were in operation in March, during April and May, about 12% just closed down. 51% suspended their activities. 29% had to curtail their operations in some form, fewer hours, do a business in a different way, restaurants turning into home delivery service, and so on. About 7% were not affected, and 1% actually expanded their work. I don't know quite who they are, but I suspect many of them are sort of cleaning services, supplying sanitizers and soap and so on. The businesses that stayed open faced considerable difficulties with both supply and demand. When we asked them whether the supply of inputs was affected during the lockdown period, 38% said that it was affected very much. They couldn't get the inputs that they needed. 38% said it was somewhat affected, and 24% said it was not affected at all. The demand for their services or goods, okay, was affected sharply, with more than half telling us that they were affected very much, and nearly 30% telling us that they were affected somewhat. So more than 80% of the businesses found a sharp reduction in their goods and services that they were supplying. Some of our qualitative data on this is very interesting. What happened was, in some ways, that social distances changed the purchasing behavior of the consumers. So the carpenters would tell us that we used to go to people's houses to do repair work. We can't get any work because people were so afraid of coronavirus infection that they didn't call us. Okay? When the weddings got postponed, it reduced the need for flower supplies. Okay? It also happened that income shocks were affecting consumers. The food prices increased, as I noted before. Okay? Incomes dropped, and consequently, the consumers were not buying the same amount of goods and services that they used to buy before. So all of this affected the demand of services for these particular small businesses. Declining business led to retrenchment of their workers. About the 30% of our small businessmen in our sample used to hire workers. Of that, 22% retained all of their workers, 18% retained some workers, and 61% retained none of the workers. They also found it very difficult to pay full salaries. Okay? Nearly 40% couldn't pay any salaries at all, and 37% paid only partial salaries. So the next question was for them, why did you not retain all of your workers? And a majority said business was either declining or closed, but at least a quarter said that they were afraid of coronavirus infection and they didn't want workers to be coming in. 11% had financial constraints. And in some minority of cases, employees did not want to continue because they were afraid of either coronavirus or they had transportation issues, which made it difficult for them to get to work. Now there is an improvement, but there seems to be a long way to go. So the businesses which were suspended or closed down, we asked them, have you now restarted your business or opened a new business? And we find that a quarter of that particular group still has not opened the business. A small minority changed business and started doing something else, whereas about 38% have reopened. What it tells us is that, and then we ask them, why is it that you haven't restarted? And of the people who have not restarted, 41% said it was because of coronavirus infection. About a quarter did not have permission from the government to open yet. About 16% said there was no demand for their products. 9% said that there was not enough money to restart, and so on. Once again, I caution you that these percentages are based on very small sample sizes. So they should be treated as instructive and giving us some idea about what's going on. But we do have to keep sample size constraints in mind. We also asked the business operators, both men and women, what did they think of the business climate in June as compared to April and May. What we found that about 26% thought it was better, about 28% said it was the same, and to our real surprise, about 48% thought, or 46% thought it was actually worse than what was there in April and May. This to us is a major surprise and something that is worth worrying about. I should note that although the small businesses experience income losses, when we look at the markers of distress that we have been looking at so far, such as borrowing money or not having sufficient food, they are very much on par with the average respondent in our sample, largely because the small businesses were slightly better off to begin with. When we look at their prior asset ownership, about 47% of the business owners are in the top 1/3 of the distribution. So they were a little bit better off, and they may have had savings or to be able to tide them through these very difficult times in terms of day-to-day household consumption. Casual laborers or daily wage workers are the most vulnerable group. Agricultural workers are somewhat protected, but construction decline has really hit the non-agricultural laborers, as well as other inaccessibility of other kind of daily wage work. Among the wage workers, agricultural workers, very few, very few were able to find work in April and May for almost all the days. Okay. But the agricultural workers, about half of them were able to find work for some of the days, whereas nearly 40% had no work at all during April and May. In contrast, among the construction workers, about a quarter had some work during April and May, whereas 70% had no work at all. Similarly, other wage workers who did other kinds of work also found that it was very difficult to find any work at all during the months of April and May. They have been coming back, but not the full force. Among the people who were able to find work, 42% said that their wages were decreased and they were able to find work, but at a much lower wage, okay, which may have contributed to the markers of distress that I'll be describing in a few minutes. Work situation is improved for the casual workers, but not substantially. About 30% are able to find work. 31% are able to find work, but with great deal of difficulty. 23% say that there is no work available, and 15% are not yet looking for work, perhaps because these are discouraged workers, perhaps they're concerned about virus infection and so on. Not surprisingly, this reflects in far greater size of the green bars in this graph than in anything we have seen before. 72% of the casual wage workers experience a large income loss. 67% had to borrow money in order to survive or to meet their daily needs. And 24% were not able to get sufficient food, okay, at least for some of the time. Okay. This is much greater than the average proportion, which is the orange bar. Transportation turns out to be a major challenge for returning to work for both casual workers and salaried workers. It's difficult to get transportation. Sometimes it just takes a lot of time because the mode of transportation has to be changed. They have to walk longer distances, they have to change different buses and so on. The cost of transportation has increased, and many find that it's very difficult to maintain social distance while traveling by bus or any other mode of transportation. I'm returning to the graph, somewhat modified graph that Santanu presented early on, where we ask people, what are the difficulties that you're facing as you return to work? And I'm just combining some of the various categories into economic conditions, which basically includes inability to get work or absence of consumers, logistical difficulties, which is transportation and other difficulties, fear of virus, and then the last bar or the last section of each bar is people who say they don't have much of a difficulty. And what you find is that for the casual workers, it's basically the economic conditions. Either they can't find work or they're getting lower wages. For business owners, it's the same thing. Either they don't have permission to open, they can't get consumers, and so on. For salaried workers, it's much more sort of the fear of virus that's affecting them as they sort of think about going back to work. And for farmers, the number of difficulties are smaller, but mainly they center around fear of virus as they return to work. Social safety nets have been improving. The government has announced a large number of measures, and we try to collect data on some of those measures, but they are rather modest. Between the DCVTS2, which was carried out in the mid-April, and DCVTS3, which was carried out in mid-June, we find that proportion of respondents who received extra ration has increased substantially. Proportion of households who received some sort of a cash benefit has also increased. And proportion of households which receive at least either the cash or the ration is now roughly about 57%. So it's a fairly reasonable proportion of the respondents have received some form of welfare benefit from the government. And the benefits seem to be reasonably well targeted, in that the richest, which is the deep brown bar on your slide here, okay, get the lowest amount of benefits, while the poorest, who are the which is the orange bar, okay, receive the most benefits. Okay. So they seem to be fairly well targeted from sort of economic circumstances perspective. However, there is also an exclusion of urban residents, which we had seen in DCVTS2, which still persists. Although urban residents are now sort of more likely to get benefits than they used to before, the rural-urban difference remains quite large. It's seen in both access to rations and access to cash. I think receipt of ration was particularly affected by the lack of access to ration cards. For individuals who have a ration card, the ability to get extra rations is the same. The problem is that while 88% of the rural residents had a ration card, only 70% of the urban residents had a ration card. So some of the measures which are being taken to sort of make portability of ration card would help. Now you might ask what happened to the e-coupons and various other measures that the Delhi government was implementing. We actually asked people, to what extent were you able to use other forms of identification to be able to access the ration card? And very few people in our sample seem to have made use of it. About a third of the sample received some form of cash benefits in April and May, but the amount is very small. of the people who received the benefits, the amount ranges from roughly 1,000 to 2,500 depending upon the source. And on average, about a third of the households received cash benefits, and the amount is roughly about 2,000 rupees. There were also some other welfare benefits that people were able to get. So roughly about 10% of the rural households have reported getting some Manrega work. 26% of the children who, or the 26% of the families in which there were children in class 8 and below in the government schools, about 26% received some sort of replacement rations since the schools are closed. So this sort of a replacement for midday meal where they were given dry rations mostly. Okay. About 8% of the households received some form of support from NGOs. Mostly it was about 4% received rations and others received masks, sanitizers, etc. So yes, safety nets of other forms are also operational, but again, they're modest in size. So as we start grappling with lockdown and prepare for phased lockdown if virus strikes in other areas, what are the lessons that we can take away from PCBTS3 results? Well, number of things. First, safety nets are a major issue and they should be expanded when districts sort of move from orange to red zone or areas where a strict lockdown starts getting implemented. Second, with unlockdown, we're going to have to worry about transportation. Transportation for farmers of getting their goods to the market, getting supplies, for workers getting to work while maintaining social distancing, which actually really boosts up the demand on transportation. Hanging on to the bus and crowded buses is not necessarily the best way of reducing the transportation. So we will have to think about what is a better way of ensuring transportation as workers return to work. The one thing I actually think that's really worth thinking about is how do we match jobs to workers? You know, the unskilled workers, how do they find work? A large number will stand at Chauraha or Chowk or Fatta, where they are sort of standing around while an employer comes with a truck to pick them up to take them to work. This is no longer easy or feasible. The informal gathering places from which people used to get work is not easy. Middlemen often find it sort of hard because they don't really know where their workers are staying, who the employers are looking for. And I think we might need to start thinking about some of the strategies for dealing with it. And in fact, I heard some interesting stories about considerations that are going on around Niti Aayog on setting up e-portals to match workers for jobs for unskilled and semi-skilled workers. That is something that would be really exciting if it can be implemented well. And I think I'm going to end here and let Shekhar take over moderating the discussion.
Thank you, Sonal. Thank you, Santanu. This is indeed an extremely rich panorama of results that we have, and I think we just scratched the surface. I know that several members of the team are working both with the round 1 and round 2 data, and now, of course, the round 3 data, which has actually taken the sample from both rounds 1 and 2. And it was very useful to see the top line messages. Perhaps if I could just kick things off, and I'm very glad that Shantanu and Sonal have been busy answering questions. I think we've got a good set already done, about 15. And I do see still another 13 or so. So please keep sending them. If we can't answer all of them here, we do have a record of them, and they'll be shared with the team that's doing the survey, and surely they'll get back to you with answers on that. What I'd like to just go back, Shantanu and Sonal, is to have you kind of both reiterate the top line messages that DCBTS 3 now gives us. And as I said, it's really very rich. But then also to draw out the policy implications that policymakers can take away. You were very right in pointing out that the whole inspiration for the Delhi Coronavirus Telephone Survey was that we wanted to be timely enough to be able to inform and provide evidence to policymakers as they were grappling with very difficult issues. The first two, DCBTS 1 and 2, during lockdowns, the first one just very soon after the first lockdown started, April 3rd, and then the DCBS 2 when the lockdown was extended without any kind of easing of constraints. So they really were kind of lockdown surveys. And then DCBTS 3 is the kind of easing constraints or lifting restrictions survey. So you've really caught both sort of phases of this. But going back to your key messages, what should policymakers take away? 3 or 4 or 5 things as we struggle, and it's reflected in some of the questions, as they struggle with suppressing the virus and limiting infections, at the same time opening up economic activity and providing as much freedom to particularly poor citizens, particularly daily wage laborers, particularly those in your occupational categories that are not doing well. So that they can actually go back to earning livelihoods. So either of you, Sonal or Shantanu, I think this is a question that's animating a lot of people and is obviously of great concern to policymakers as well.
I think there are 2 areas where we need to pay attention. First is when you institute a lockdown. And I'm not convinced that we are getting out of lockdown. I suspect in some areas lockdowns might get intensified as the virus sort of proceeds to those areas. Right? And when we begin to institute a lockdown, the very first thing I think we need to think about is who's going to be affected most and how do we provide safety nets in a way that is sort of effective. Okay? So it seems to me that it is when the lockdowns get instituted that there should be a sharp boost up of the both cash transfers and PDS supplies. And I think one of our problems has been that all of our safety net mechanisms has been set up around sort of with rural population in mind. For example, Manrega. Okay. For example, some of the PM Kisan Yojana. Okay. So in some sense, thinking through how we might provide cash transfers to urban informal sector workers would be something really worth thinking about. The second part of it is sort of just coming out of lockdown. And I think that we are really going to have to focus on issues around transportation, because transportation, it's the key to get people to work. Okay. And the transportation is basically, we are dealing with a country in which there is a lot of transportation, which is basically very crowded. Okay, so so as not to sort of increase the spread of virus while allowing people to get to work, we may need to think about a variety of strategies which sort of make it easier to get to work there, which will require some staggered working hours, which may think in terms of sort of businesses where some of the put out kind of work can be provided to people at home. Okay. I also think that for small businesses to open safely, a system of maintaining social distance while opening the business will have to be put in place, and both through policymakers and civil society be implemented. Okay? Creation of barriers, creation of distance while the business is open would be something that we really need to think about. And I actually see that some thinking has been going on in that area. Okay? But we may need to think more about it. Thank you.
Shantanu?
Yeah, I think that's the most important question you have raised. So I think we continue, reopening, continuing sort of opening the economy in a phased manner, we have to do that because we have seen that majority of the households have been impacted when during the lockdown. So keeping it closed is not an option. So also the other important thing is we have to how we can remain safe. So I think that's why the communication messages around changing behavior that people have already done. I mean, have done to an extent which we have not seen before. So we have to continue doing that. We have to take precautions so that in spite of going out, in spite of continue doing some activities that would help generating income, we are able to maintain or adhere to those guidelines, to those precautions. So I think that is the key issue here, that the policymakers need to put an importance to that, I think.
Okay, Shantanu. I'm going to take a few questions that you haven't answered. I see that we have answered about 15 of them, but I still see another 20 that are open. Pina Agarwal suggesting subsidies relating to your issue on transportation, subsidies for the purchase of bicycles and other forms of sort of individual transport that are easy and that also can help maintain social distance because they are individual, single person, or at best a family with the pillion rider. So any thoughts on that, going back to your transportation question?
Bina, as usual, has great idea. I think that this is actually a very good idea. In as much as it, we have seen that actually bicycle subsidies have worked in getting girls to school. So why not in getting workers to their workplace? I think this is certainly worth thinking about.
And possibly a suggestion to our corporate friends that CSR in the form of, for example, bicycle purchases or subsidies, particularly for bicycle manufacturers, might not be a bad idea in these coronavirus times. I see a whole bunch of other comments, and feel free, Sonal and Shantanu, you see them as well, to pick up any of those questions. The one thing that I see in a lot of these is this issue of the occupational classification that you have. And do we see a rural-urban divide here as well? I guess it's a second order set of analysis that you're going to do, and I know that you run into small sample sizes as well, but being able to differentiate between the daily wage worker in a rural setting and in an urban setting. We haven't done that as yet, have we?
Oh, breakdown by occupations we have not done yet across different sectors, but we have looked at some of the other experiences across different sectors, and we do find that this is unlike our historical experience of rural areas being much more vulnerable to economic crisis. This is one area in which we are actually seeing urban households being more vulnerable to economic crisis. And remember, we are looking at Delhi NCR, which are actually urban workers are relatively well off. As we sort of move into other states, I suspect rural-urban divide might become even more stark.
Shantanu, anything on that you want to add?
Yeah, I mean, I think we have sort of looked at the situation of agricultural wage laborer versus construction wage laborers, and there we have seen that construction wage laborers or other manual wage laborers are far worse off compared to agricultural wage laborers. So I don't know their distribution in urban and rural areas, but that's the overall among casual wage workers. That's what we have seen.
And just to complement what Sonal said, and I think it may respond to a number of questions that are suggesting more detailed work. There is a second survey that NCR has just completed on the socioeconomic and the health consequences of COVID-19. And this is very focused on just two states, and this is coming up with some really fascinating and interesting results and very policy relevant results. The two states are Uttar Pradesh and Odisha. And again, we've leveraged off existing samples, and we've leveraged off an existing piece of work that was in-person surveys, but retooled it to 2 telephone surveys. And we expect to do another webinar very shortly in the next couple of days, perhaps even, when we will present the results from this. This is work that NCR is doing jointly with the Nozzle Institute for Health Economics at the University of Melbourne in Australia. So please look out for a notice for that, and I'm sure that we'll have very interesting results from that that we'd like to say. You know, your comment, Sonal, about preparing for lockdowns and a whole genre of social safety nets that are designed for quick lockdowns, for quickly ensuring, and obviously it's a pandemic related issue mostly. I don't think in kind of a tsunami setting or a natural disaster setting you'd be doing that kind of a close down. And somebody commented that it's like a submarine that's taking a deep dive but has kept the hatches open. And so that's a bad way to dive for a submarine. And so it's a bad way for a country to do a lockdown without all the due precautions that are being taken to ensure that citizens are being protected. And that's something clearly in many countries that has not happened. And in a sense, we suffered greatly because of that. Any other thoughts on the questions that we are seeing? I see one by Arpita Ghosh on routine healthcare service delivery. Was it severely affected during the lockdown? It was severely affected during the lockdown. This is non-COVID routine healthcare access. And I know that you had a question on this. So do you think our households are beginning to receive or utilize health services now during the unlocking phase? Did we catch this, Santanu or Sonal?
This was not a question we actually ended up asking ultimately.
We did have a question in 1 and 2, right? About routine access.
Medicine. Okay, what do you
Yeah, 1 and 2 we have about whether they're visiting healthcare facilities or not, but not specifically on different healthcare services. But I think the other survey, Dr. Shah, that you mentioned, that NCAER did recently, that might have answers to this, I think.
Yes, because it was specifically about the health consequences. So there's a lot of work that was done.
Yeah.
Rasha Omer has a question on, is there any analysis of the impact on businesses located in urban and rural areas? Businesses in rural areas would fare relatively better in terms of income and payment of wages to workers, and that this could be correlated with more sustained demand in rural areas as farmers were relatively less affected. And Rasha works for IFAD, so that's understandable where the question's coming from.
Rasha, this is a very pertinent comment. We have been looking at a variety of other sources of data, comparing different sectors, and it looks like the rural areas have emerged relatively with relatively lower impact than urban areas, and it seems to be showing up in a demand for goods as well as ability of people to find work. So while we are looking at it from sort of more household size, okay, I think it also sort of translates into what would be the experiences of MSMEs, which are sort of either selling in rural areas or based in rural areas. So yes, my guess is that this is one particular incident where we are going to see rural areas surviving somewhat better than urban areas.
Return to the soil, right? Rasha also had a question about, what do your results show us about potentially useful and efficient ways of supporting MSMEs? I know that Mr. Gadkari just released an MSME task force report last week, and I think we're still catching up with it. But are there suggestions here for how we might tackle perhaps one of the worst hit sectors, which your results themselves show the mortality rate of these businesses is large, and so do we have results here that can guide our policymakers on the most effective use of policies of financial support or other kinds of support?
I think that a lot of these policies will become sort of more sectoral in nature. So, for example, construction is a major employer of informal sector workers. Okay? Construction has been hit hard. Now, one of the most interesting things has been that, and this again comes from some of the qualitative interviews that one of my colleagues, Reem Ashraf, was doing, that the construction employers are actually very uncertain about how to sort of restart. There are some requirements with respect to the workers needing a health certificate, workers needing a safety kit, which is difficult for them to get, and consequently often it's hard for employers to find workers, it's hard for workers to qualify for work, and so on. So thinking through taking some of the large employers and working through what they might, how they might be able to hire people safely would be very useful. When it comes to MSME, I think that we perhaps want to distinguish between the registered and unregistered enterprises. Our sample largely had a lot of small employers, would be unregistered enterprises. But I think the registered MSME actually some of the benefits via GST discounts would be a worthwhile thing to think about. Okay? In the US, one of the things that we have been reading about is that the government actually put in place a payroll protection plan by which some of the employers could get government loans, and as long as they retained their workers and paid them, they would not have to pay back some of those loans. This seems to be working. There are a lot more people employed than there might have been otherwise. So thinking through something that sort of provides financial incentives for small industries would be a very worthwhile thing. I think for the micro businesses, really, it is being able to operate safely with the relevant social distance and get the goods and services to the market would be very useful.
Do we see a conclusion coming out of these results that cash transfers should be made faster and easier to access, and that clearly would be a huge push both in terms of livelihood support and income support, but also boost to demand?
I think you're right that yes, it should be done and done well. I think we have actually done a reasonably good job of cash transfers for programs that already existed. There were linkages with Jan Dhan accounts that made it easy to push the cash out quickly. There were linkages with PM Kisan experience in the past, so that it made it possible to push out cash quickly. The problem is that we don't have universal linkages, and we have very scheme-specific linkages. And whether those scheme-specific linkages are right in the current situation, we don't know. So thinking about who is the most vulnerable and how do we make these linkages to be able to push the cash out quickly would be a very relevant and useful thing to do.
Anything on PDS that we found? Because that's also been one of... Sorry, go ahead, Santanu.
Yeah, just one thing on the cash. I think also the amount is not adequate. I mean, you transferring 500 for the Jan Dhan account holder or 750 for Ujjwala, that's not enough, I think. Yeah.
I was going to ask about PDS because there's the one ration card idea. Debolina Kundu has a question on that. Any thoughts on the one nation, one card idea that has been put forward?
That's an idea whose time has come for a long time, and this current situation is where we sort of get an impetus to do so. Clearly, with some of the what we have been finding is this: if people had a ration card, they were able to get the ration. Okay, the extra ration that was being distributed. For people who didn't have it, the alternative systems were simply not adequate and not in place. So it is definitely the case that one nation, one ration card time has come. The question is just making sure that it can be effectively implemented is going to require some challenges, because it's not just that you should be eligible to get the ration. The PDS shop should also have the supply, and the PDS shop owner doesn't always know how many people are living in his or her catchment area. So we'll need to think through some of the logistics portions of it, but clearly its time has come. I think had it been in operation, perhaps some of the migrant crisis that we saw might not actually have happened.
Okay. We just have a few more minutes, Sonal and Shantanu, and I really appreciate everybody's patience. We're close to 8 o'clock when we finish this webinar. I just thought I might ask either of you, both of you, we are presenting early preliminary results, but there's obviously a great deal of richness here, and as I think most of our viewers and attendees would know, at least the first round and now a portion of the third round relate to a survey that's been ongoing called the Delhi Metropolitan Area Study, which our center is doing. So we have a lot of information about those households. Maybe you could take a few minutes as we close to describe some of the work that our teams are doing in sort of deeper analysis of the questions. I know we've done some internal discussion around this last in May, actually. Any thoughts on that and sharing with our viewers some of the more detailed analysis of work that is happening?
So we have work going on in two areas. One is around protective behaviors that individuals are undertaking, and the other is around economic consequences. In terms of protective behaviors, one of the things that we are trying to see is whether the households in which there are people who are high-risk people, such as people with diabetes, heart disease, and other conditions, do they follow a very different type of social distancing model than others do, and whether their perception of how much at risk they are is different from other people's perception. Households which have young children, households which have elderly, do they sort of behave differently? And there is a bit of a work going on in that particular area. The second, along that line, we also found it very surprising that in spite of everybody being aware of the dangers of coronavirus, people don't seem to always internalize risk. And I think that there is a lot of interesting work going on in psychology and behavioral economics, where we think that people feel that taking some protective measures basically insulates them from risk. So we actually want to see whether, some of the false beliefs might sort of make people take greater risks. As with President Trump, his idea that if he's taking hydrochloroquine, he doesn't need to use masks. Okay, so in some sense, trying to understand what is it that, and what are the characteristics of people who seem to see themselves at a lower risk is something we are trying to do. On the economic side, we are trying to actually look at households in the sense of the economic crisis, whether it is affiliated in any way with families that have diversity of economic enterprises that are going on, where some members are working in a salaried segment, some members are in farming, some are doing casual labor, whether this diversification helps. whether having actually women participate in certain activities helps diversify income source and reduces the sense of or actual experience of financial catastrophe, whether households that were receiving remittances are more protected. So those are the kind of areas in which we are looking at these issues. Our hope is that when the COVID infection threat recedes and we are actually able to carry out face-to-face interviews, we will be able to go back to these households and better understand what actually happened to them during this particular period. While we are very proud of our telephone surveys, 15 minutes of a phone discussion doesn't allow for the kind of depth and detail that one would like to get.
So I just shared on the chat some of the topics on which our researchers are working. I'll just read them out. Factors leading to the widespread perception of no risk of coronavirus infection in the Delhi NCAR. Debashish Parikh and Reem Ashraf are doing that work. Inequality in the loss of income and experiences of supply shortage, Pallavi Chaudhary. And a methodological examination of to answer or not to answer what determines responses to telephone surveys in times of lockdown, which Neeraj Deshmukh, Manjishta Banerjee and Reem Ashraf are also doing. So we are at 7:58, and I'll take just the last few minutes to thank Sonal, who is actually coming to us from Washington, D.C., where she is currently. I hope Washington is not facing a resurgence of the virus. I hope people have not gone gaga and sort of dropped social distancing, as some places around in the Sunset and the Sunshine Belt have done. So I hope you are safe, Sonal, and thank you, Santanu, here in Delhi, for joining and for this excellent expose of our work in the DCVTS 3. And finally, I'd like to thank all our 70, 80 plus participants who joined us. Thank you for all your questions. I hope we answered some of them. The questions will be shared with the team, and if they can, they will of course get back to you with their responses to your questions. So with that, let me close out and thank everyone again. Any final words, Sonal and Shantanu?
I just wanted to thank our advisory panel that helped us design these questions. I'm screen sharing, and I really appreciate your inputs in designing the questionnaire, including some of my internal colleagues like Varnari Bhandari, Shashanka Bide, Dr. Manna, Dr. Shah, Dr. Sharma. Thank you.
Yeah, we'd like to thank all of them, especially our panel. I see that Rinana Jabwala is or was on this webinar as well, and we hope to remain connected to all of you. So again, thank you for joining us. We really appreciate your being with us, and we look forward to your being with us at our next webinar in this series. Good night, everybody. Thank you.